Testing has been a major topic through the coronavirus pandemic. We all know that. There's a good chance that a lot of you watching at home have taken a COVID test between now and back in March of 2020. Time flies, right? Well, the testing conversation, it seems to go in cycles. There will be times with really high demands, and there'll be times with almost no demand at all. It all depends on what the virus is doing in Idaho. Now, more recently, rapid at-home tests have become really popular. And why not? You get a quick result, and then you know what you need to do next based on that result. The trick these days is trying to find one of those at-home tests. But some good news this week. President Biden says he's ordering 1 billion at-home COVID tests for Americans with the idea of sending them to people in need at home for free all across the country. But how does that impact clinic and lab-based testing? Because, as we know, at-home rapid tests, they're not reported in the state data. And with the emphasis more on those tests now, will public health data suffer because everyone's just testing at home? Meaning, are public health officials concerned that they're going to lose out on all of this data and they're not going to be able to track the virus the same way they've been able to since early last year, simply because they're not going to have the data? Well, I spoke with experts from the state as well as a major testing outfit in our community for perspective on the home versus lab test debate. With the spread of the highly contagious Omicron COVID variant, getting tested for the virus is, again, a very popular activity. Just ask the people like the team at Crush the Curve.
Yes, we have been really busy. This week, we have been running a small community site at full capacity.
Maricela Rios is a testing site coordinator for Crush the Curve. Rios tells me people stop by for a COVID test for a variety of reasons, but they have found that a lack of rapid tests has certainly pushed people to getting a lab-based PCR test through places like Crush the Curve.
Yeah, there's been some frustration that's been expressed. Like, we're looking for a rapid. You know where we can get a rapid?
The plain truth is that rapid at-home tests are out of stock nationwide. The only option some have is getting an appointment at a clinic.
Testing is very busy. It seems throughout the course of the pandemic, what we've observed is every time there's a huge spike in positivity, there's a corresponding increase in demand for testing.
Dr. Christopher Ball is the chief of the Idaho Bureau of Laboratories. Unlike the store-bought rapid tests, Dr. Ball says Idaho is seeing availability for people looking to get tested in a clinic and have their samples sent to a lab.
They seem to say they've got adequate PCR capability. There may be some limitations for a lot of healthcare settings. I know that staffing has become an issue, so I think that may be what is limiting some of the appointment times. From what we're hearing, there still are appointments available for PCR testing if people are willing to wait.
The wait is for getting a test and for getting the test result. Combined, the wait can be a few days. That's why rapid at-home tests are so popular right now. Some good news this week in that vein. The Biden administration says they're ordering 1 billion rapid tests to send to Americans for free. It's important to note, though, that people who take rapid tests at home, they're not included in data metrics tracked by the state or the country. So, as people continue to shift away from PCR tests taken at places like clinics, public health experts miss out on valuable data.
I think it's a real balancing act that we're trying to. We definitely need to have, people getting PCR tests so that we can continue to describe the dynamics of the pandemic. But as we move towards more convenient at-home options, I think it's better for people in terms of convenience and being able to hopefully limit transmission.
Dr. Ball says the at-home rapid test can be really helpful, though, if people take them seriously.
I would be willing to sacrifice a little bit of the visibility we have on the pandemic if people are actually going to take a test and isolate themselves if they're positive. And take appropriate actions to limit transmission.
So, how does the state lab and public health experts adapt to people leaning more towards at-home testing?
We in public health love to have data so that we can communicate to the public the severity or the reality of what's happening. As we start seeing fewer and fewer people contributing to that test numbers that we can report on, it does become more challenging to interpret what the pandemic really looks like.
Dr. Ball tells me the state is considering other ways to track the virus, and we're going to talk about one of those in just a minute, wastewater testing. First, though, I mentioned free rapid at-home tests that the U.S. government is going to send out, and we actually just got details on how this is all going to work. So here's what we know. The White House says at the federal website where Americans can request their free COVID-19 test, it will begin accepting orders coming up on Wednesday. So we will remind you as we get closer to that. They want everyone to know that supplies will be limited to just 4 free tests per home. And the White House says that tests will typically begin shipping within 7 to 12 days of ordering through the United States Postal Service. So they're hoping to get them out in 1 to 3 days based on that time in their first class package service. So if you were looking to get one immediately, this isn't going to help you, but you're going to be able to request one of these and have it ready if you choose to do so.